In regards to trends, we are seeing higher numbers. 2016, we saw 32 overdoses. 2017, we saw 65. 2018, we're sitting at 18 overdoses right now. It's not just opioids. When we look back at the data, we're looking at about three-quarter of our overdoses are opioid related. For example, heroin. But we're also seeing heroin mixed with fentanyl. We're seeing fentanyl all by itself. We're seeing cocaine. We're seeing cocaine mixed with fentanyl. We're seeing methadone all by itself. We're also seeing methadone mixed with fentanyl. So it's not just an opioid problem. It's an in general drug problem that we have in our community. Another thing that we're seeing too, although a lot of and the greater portion of our deaths are in the 616, 03, 04, 05 zip code, I would say by about half of those people do not reside in those zip codes, which is when I look at the overdoses throughout the city on the city map, a lot of those overdoses are and our deaths are occurring where they're purchasing the drugs, but it might not necessarily be where they reside.
Sir, are you seeing that most of the opioid deaths are due to street drugs? Or are you seeing them due to a prescription drug?
That's a good question, Andy. I think most of them are street drugs. We're not walking into a resident and finding bottles of Vicodin or oxycodone laying around that are being used. These are particularly street drug use.
We have heard over the years that part of the reason for the opioid epidemic is due to an over use of of opioid based killers. Are you finding that maybe while they might die on a street drug, that their drug use started as a result of a prescription drug, or no?
In the research that I've looked at, and I can confirm this throughout my nursing career, 4 out of 5 of these opioid users or drug addicts, as we're calling them, are using started with a prescription painkiller. Back in my entire nursing career, I can recall it being pounded into our head. Don't forget to ask about pain. Don't forget to give them their pain medicine. Don't forget to make sure that we're reassessing and giving them pain relief. Way back then, the Joint Commission actually told us we have to ask about the fifth vital sign, which was pain control. And then hospital reimbursements were dependent upon satisfaction scores. And if we weren't meeting a pain control need for the patients, then the reimbursements were affected by that. So, of course, it was driven by how much care of the pain are we taking as healthcare providers. Well, that when you look at the CDC recommendations now, we shouldn't be treating sprained ankles, strains, sprains, minor body aches with opioids. There are other alternatives, and that's really what needs to be coming from the healthcare industry and the profession is rest, ice, elevate, a non-steroidal anti-inflammatory to take care of minor pains and injuries. We have to get away from this overprescribing of opioids.
As far as you know, you mentioned that many folks might be dying in locations where they do not live. Where are you finding folks? Are they in cars? Are they in houses? Are they on the street, or do they drive back to their house? Is this like a party house? What is up?
I think one of the things that we're finding in our trends is that people are actually making their purchase and they're using where they purchase. I can recall, I think 4 or 5 weeks ago, we had a lady in a home who actually did not reside there at all. And that wasn't the first incident. It wasn't isolated. A lot of people are actually using where they purchase, and that's where they're dying.
There has also been a trend, sir, of folks going to like local fast food places or stations. Have you heard about that?
Yeah, we actually have had several overdoses. We had one at the McDonald's up on in the I think the Thousand Block of North Knoxville. We've seen them at a Taco Bell restaurant, at a gas station as well. So they may not be using exactly where they purchased, but they're in that same geographical zip code in that area. As soon as they get it, they're going to go and use.
And do they tend to use in places like that because it's close, or do they tend to use in places like that? Do you think after talking to their family because they know if something happens, someone's going to check the bathroom, or check the place, or check the car, or whatever.
I think we can pinpoint that they're going to use in the geography where they purchased. It's at closest places of where they were, they're going to go and use. And sometimes that might be a McDonald's, it might be a Taco Bell, it might be a Shell station, wherever they're the closest to where they obtain their product. I've had family sit in my office and say, I have no reason, they have no reason to be in that area where they were, and they're dumbfounded of where they're found deceased. So I think I think that really follows the trend of the statement I made.
What I'd also like to know is you talked about drugs being mixed with other drugs. The local police had issued a statement a few months back saying that there was coke mixed with fentanyl, but that later turned out to be not so true. While this is post mortem, are you hearing that these are drugs that are laced with things, or that they are using multiple drugs?
I think it's both cases. You know, if I pull up a case file right here and look through here, I see cocaine and another associated drug. In this file right here, it's methadone mixed with Xanax. This case right here is cocaine mixed with methadone. So a lot of times it is a multi-drug situation, but when we're talking about cocaine and fentanyl, generally it's going to be a laced situation. We're not finding deceased people with fentanyl patches on, so the drug had to come synthetically somewhere.
How does one take fentanyl? Is it through? Do you shoot it up? Is it a patch or what?
Fentanyl generally is what we're finding is mixed with another drug. In a street sense or in a hospital setting, it's an injectable, which can go subcutaneous with a needle, or it can go through a patch on the skin. That's really difficult to obtain fentanyl in that setting. It would have to be stolen or obtained from some other source. So it's my perception and in my research is that it's mixed with the cocaine from another party.
As far as the mayor here had convened a task force to start looking at all this stuff a few years back, and they're going to have a big summit next month. What have and you have taken this cause on in the past 14 months. What can you say about the current state of opioids?
It's going to take more than one hand to fix this issue or to even make a dent in this issue, and it starts way back with the prescribers. We have to have some regulation on what's being prescribed because it's a fact. 4 out of 5 people who have used an opioid are now addicted to heroin or are opioid addicted. It has to start with the prescriber. The second thing is we have to have on some sort of state and federal level access to treatment. When the addict gets to a point where they're ready for treatment, they have to have a place to go, and that's a huge barrier right now. And not just Peoria County, not just the state of Illinois, but nationwide, access to treatment is a huge, huge problem.
But sir, there are a bunch of places here in town. Are you talking about beds, or are you talking about the cost?
Both. Uh, if you decide you need healthcare treatment for your opioid addiction and you arrive to the place, if you don't have money to pay for it, the door gets closed. Now, the Human Service Center here in Peoria does have beds, but there's waiting lists for the beds. And that intricate moment when they decide for treatment, the bed has to be available, the finances for the bed has to be available.